Good morning, everybody. Thank you for joining us today here on this Monday. If we haven't met yet, my name is Courtney Hartman. I am one of the group health specialists in the Health Plan Options Department at URL Insurance Group. Please don't hesitate to reach out to me or anybody on my team for assistance in the group market. Some quick things. Everybody should be muted to avoid any background noise during the presentation. So if you do have any questions, please use the chat feature to the right of your screen. Handouts along with this slide deck are also available to download under the Handouts tab to the right. And now that everyone is familiar with who I am excited to welcome Allie Best, the Regional Sales Rep for Ameritas, who will be going over the dental and vision products. I hope you find this session valuable. Thank you again for being here. And without further ado, I'll turn it over to Allie.
Great. Thank you, Courtney. Good morning, everyone. I'm happy to be with you all this morning. I'm going to be going over a little bit about Ameritas' product. Any questions you have throughout, please put them in the chat. I will try and get to them as soon as possible, but if I don't get to them, I will definitely get to them at the end. So we're going to get started. To get started, I work for a company called Ameritas. We are in the business of selling life. That is not life insurance. We are in the business of dental and vision insurance. Our saying is we're in the business of selling life, but we don't do life insurance. So we do have an individual life product, but that's not what we're going to be focused on today. To get started, in terms of who my team is at Ameritas, and feel free to jot any of these emails down. We are all happy to help. We're all here to help you and make your life easier. But I am your main point of contact. Any questions, concerns, anything that comes up can be directed my way. My name is Allie Best. My full name is Alexandria. I'm your regional sales representative. I live in Philadelphia, but I am focused on that central Pennsylvania / northeastern part of the country. So any questions you have, or not northeastern, northwestern part of the state. In terms of my sales support, Pam, she is more my internal support. You may see her from time to time hop up on emails. If you do get an email from her, she's working with me. She's part of my team. Don't be surprised. She might just be here if I'm on the road, she might be sending emails or just kind of keeping in touch and making sure everything's going smoothly for me. Nicole Goodwin is my manager. She is great. She is more, if anything gets escalated, that's where we'll go. Anyway, with her, the most important thing to say for her is just, if you see her, that means we're going to have to escalate something, and that's why she's around. She's also a great resource, but that's more her focus there. In terms of what we're going to be talking about today, we're going to start with the importance of dental and vision insurance. We're then going to go into an overview on Ameritas Group product. We're going to speak on individual dental and vision insurance, understanding trend versus what your group needs, and then network strength and resources for you. So we have a lot to cover today in a short period of time, but please send in the chat at any point if you have any questions. To get started, the importance of dental insurance. Financial protection. This part you all understand already. You've all been in insurance. This one's simple. This is dental insurance saves you money. You never know when things are going to go wrong, go awry. We all love to believe that we're different than everyone else and nothing can happen to us. But by having dental insurance, that gives us a little padding for if something is to happen to us. Pre-tax premiums. I'm sure you also understand this part, that the premiums each month are taken out before taxes are. There are some state and local regulations that are different. However, for the most part, in most places, that premium is taken out before. So this is money that is directly used for you and dedicated to you. In terms of what else it does, ease to access for preventive care. this is where I'm going to focus my energy on and my attention on. We're going to talk a lot about this part. And then this lower out-of-pocket expenses kind of blends in with that financial protection. By having insurance, you're not going to have to pay as much out of pocket for your care. In terms of why you should sell dental and vision insurance as brokers and agents, over 60 health problems can be detected with dental care, with that simple preventive care. That includes diabetes, heart conditions, Alzheimer's, and many others are associated with gum disease. So by going and getting that periodontal care, there's a chance that something else can be detected. And that early detection is key at the end of the day. It can save you so much money on that medical care by simply having that early prevention on the dental side. 90% of people are affected by tooth decay between the ages of 20 and 64. None of us want dentures at the end of the day. We all want to keep our full mouth. Our teeth are one of the most important parts of our body. So by taking care of your mouth and taking care of your health, it ends up helping you in the long run. 1 in 5 Americans say their vision provider detected a non-eye related health issue. That is 20% of the US has said, hey, something else was realized when I went to the eye doctor. That is a huge portion of the country that has had another issue found by simply going to the eye doctor. And then the last thing I want to mention on this slide is over 270 diseases, including diabetes, high blood pressure, autoimmune diseases, and cancers can be detected by going to the eye doctor. So there really is no excuse for not going to the dentist and the eye doctor. And by having dental and vision insurance, that is just easing it, making it easier for you to be able to get that care quicker and easier before things escalate. And hopefully you can get ahead of these things. So those are just a few of the reasons why it's so important to include dental and vision in your pitch to your clients. On to the next slide. So established oral and overall health connection. This we kind of talked on the last slide. However, I'm going to go into a little bit more depth on this one. Periodontal diseases are linked to chronic health conditions such as diabetes and coronary artery diseases. By simply going to your periodontal visits, you have a chance to clean and making sure your gums are actually healthy before it escalates into anything bigger and more difficult to deal with. I'm going to go into the money saving factors on the next slide, but it is truly critical that you get that care done if you have chronic health conditions such as diabetes and coronary artery disease. I also, in the handout section, there is a packet that kind of goes over all the data I'm using. So I'm not going to go over exactly where my sources came from in this presentation. However, in that handout section, you'll be able to figure out more on where this data is coming from and look it up yourself if you're interested in any of these kind of things. Expected mothers with untreated periodontal diseases are up to 10 times more likely to have premature or low birth weight babies. So what I mean with that is it's super easy, especially when you are in your 20s and 30s, to say, hey, this can't affect me. I don't have to worry about this yet. However, by simply, once again, going and getting that care done, there's a chance that you help your future offspring. And that's extremely important. Give your children the best possible chance. Periodontal issues can contribute to age-related conditions, including neurodegenerative diseases. So we got the two sections, the two different sides of it. However, once again, it is so critical to just care for your mouth, and it will end up helping and saving your clients so much money by simply taking care of yourself. Impact of dental care on medical cost. If you do not go with diabetes, if you do not go to the dentist, you end up paying up to 20 to 25% more on your medical care. Why is this exactly? You are no longer worrying about, or if you go to the dentist, you're able to get ahead of it. You're able to get ahead of that care. You're able to protect yourself at an earlier point. And then in exchange, you were able to save money. By not going, some issue within your mouth can escalate and get bigger and mutate into something a lot larger. And then you end up paying so much more for in-hospitalization, patient care, any of that kind of stuff. You end up spending so much more money. So this is another reason why, especially for people with chronic issues, it is so critical to get dental care. Okay, so I do have a question on this. I'm going to put this poll live. Answer this. I'll give everyone a minute to answer all of these questions, but let me know if you can see it. Okay. All right. So the correct answer on that one was 20 to 25%. So you can save 20 to 25% on your overall in hospitalization care by simply going to the dentist. So moving on, now we're going to go into more depths on who Ameritas is, what our product is, and talk about that part. To get started, we are in the business of fulfilling life, as I mentioned in the beginning. Our focus is your head, your dental care, your vision care. We are focused on those parts of your body. We've been offering dental insurance since 1959. We've been offering vision insurance since 1984, and we currently have $1.7 billion of annualized in-force group premium. So we've been doing this for a while. Ameritas is not new to this game. We may be newer to this area. However, we've been around for a while. The company started back in 1870s, and we have just continued to create new products and change and vary our products based on what the market has demanded of us. In terms of what makes us different, I'm going to spend a decent amount of time on this slide, just going over what makes us truly different as a company. If you do have any questions on any of these things, please let me know. To start, we have our Fusion product. We offer a dental plan that helps pay for those out-of-pocket expenses. Once again, if you have any questions on this, you can also feel free to email me out after our presentation. I am more than happy to help. So offer a dental plan that helps pay for those out-of-pocket vision expenses. What I mean by this, as a company, we have created a product where you are able to embed a certain amount of money into your dental maximum that at the end of the year, you can utilize towards your vision expenses instead. So typically it's usually around $150. This $150 does not need any sort of coordination of benefits. At the end of the year, provided you have not utilized your full maximum, you are able to utilize that money towards your vision expenses. You simply, after your other insurance carrier takes out money for your vision care, you send that bill to Ameritas, and Ameritas will send you a check in the mail for $150. It just gives you a little bit more flexibility to get those lenses you need, those frames that you need, whatever it may be. It just gives you that extra little care to make sure that you are protected and you get what you want at the end of the day. Or if you need a second exam during the year, it helps pay for that. It allows members, we have another product called our Dual Choice Vision that offers members to choose between VSP and iMed for vision. So you get that choice between, not you as the broker, not the employer. You get the choice between VSP and iMed or vision. All we need is 20 people to be enrolled in the group, and then we can offer this product that allows employees that flexibility. We offer this product at the exact same rate. So VSP and IMED, we go out at the same rate, and based on where their vision providers land, we will make sure that they are protected. So it is a great product. It is extremely popular to offer those two products, and it has had extreme success. We all know, as in this world, out-of-pocket vision or out-of-network vision is not very good coverage at all. So by having this product, it just ensures that there is more flexibility for those employees to make sure that their doctor and their eye doctor is covered under a network and they're getting the best care possible. Our lifetime deductible, this is one of my favorite products. Instead of doing that calendar year deductible where you have to pay every single year, instead, you were able to pay a deductible once over the lifetime of the plan. The plan's in place for 10, 15 years. You pay year one, you never have to pay it again. It's waived for type 1 procedures, just like your typical calendar year deductible. The only difference is you pay it once and you're done. Dental rewards, just like dental rollover plan that Guardian offers and a lot of other companies offer, it helps you increase your maximum. Once you reach a certain threshold, or as long as you stay under a certain threshold, and you go to the dentist once during the year, you are able to increase your maximum. You're able to increase it for up to 4 times, and you do get an extra bonus if you go to an in-network provider. Our response to the market. So by simply, when we created dental rewards, we were curious on the impact of it. We sent out a survey to see what % of people went back to the dentist for a follow-up care after dental rewards were implemented. Before implementation, only 17% went for that follow-up care. After implementation, we had up to 50% of people going back to the dentist for follow-up care. That is a huge difference in the amount of people who ended up going to the dentist for that needed follow-up care, because they, at the end of the day, felt more comfortable, like they had the possibility to pay for more due to dental rewards helping pay for their care. So extremely important. It does just give those employees so much more flexibility in going and making sure they care for their mouth. And going back to what we talked about before, it makes sure that employees are so much more protected to prevent any of those periodontal related diseases, any of those kind of stuff, by simply just having a little bit more flexibility with that maximum. All right, to go over our individual product now. Our goals as a company, product simplicity. We don't need it complicated. It's already difficult enough to understand insurance. This is dental and vision insurance at the end of the day. It should not be causing a headache. It should be simple, it should be easy, and you should be able to figure it out pretty quickly at the end of the day. Ease of enrollment. Super easy to get in. You go to our website. I will link that website at the end so you have access to it. You go to our website, you simply type in your zip code, you find your products, you enroll into a dental product, a vision product, or vice, you can do one or the other, and you enter in your information. You are able to get in next day. Your clients are able to enroll by that next day. Member value. This is most important. We are not trying to trick anyone. We are not trying to make anything more difficult. By making and providing member value, this is what we put at the forefront of everything we do, making sure your members and your clients are protected. Product and network confidence. We, throughout the nation, remain in the top 4 to 5 nationwide amongst all the networks. So you can have confidence that your employees or your clients will make sure and they can be confident that they will be able to find an in-network provider. And then we have industry knowledge. As I mentioned before, we've been around, we've been doing dental insurance since 1954. We've been doing vision insurance since 1984. So we've been around for quite a long time. We know what we're doing. We constantly adapt and change as the environment calls for it. A company you can count on. I've talked about this before. Dental since 1959, vision since 1984. We've talked about this. Large dental network. We have more than 592,000 access points nationwide. What is different between locations and access points? Because later in this presentation, you'll see that we have over 200,000 locations. Access points is providers. If a dental provider has multiple offices and they change offices throughout the day, they're counted twice. So, important piece of knowledge just to remember, because it can get kind of confusing in that area. A large customer base. We have over 11.4 million customers in just that individual side. So, cover a lot of different people. We know what we're doing. You don't have to worry about your clients when you place them with Ameritas. Industry rating. We have an A+ from Standards & Poor and an A from AM Best Company. In terms of our product rating, we were rated the best dental insurance company for seniors. As I mentioned previously, we do not rate based on age. We rate based on location and industry for that group product. So by not rating based on age, those seniors are able to get a product that is extremely more affordable than some of our competitors are able to offer. Our call center is recognized continuously by Benchmark's Portal Center for Excellence, and we've been receiving that award since 2006. We have a 4.5 out of 5 caller satisfaction score. So people are extremely pleased and happy with our call center. I will say, and I think this is honestly really important to tell everyone, they give me, as an employee at Ameritas, the same number that they would give any of you to call. They did not create a separate line for their employees to call if there's an emergency. We all call the same number because that's how much confidence they have in their call center. When you call, you are calling somebody who is located in Nebraska. You are not calling somebody who is located overseas. All of our employees live within the United States. You call, you are going to get somebody who is in America and is ready to answer. Somebody will always answer within a minute. And there is not that many annoying AI questions at the end of the day. We do have a couple just to make sure we are leading you to the right department. But other than that, that's all you have to answer. You get a real person in America that answers you fairly quickly. So just peace of mind when something does inevitably come up. Product innovation. As I mentioned, with our product, you can have next day coverage. There are no waiting periods. This is important to mention. Although there's no waiting periods, starting day one, you are not going to get the same coverage as you will a year or 2 years into it. So although there's no waiting periods, it's still not the same coverage day one as you will be able to build up to. However, if you do have credit for prior dental coverage, you are able to enroll and show that you get to that top level automatically by simply having coverage previously. We rate based on zip code, not age or gender. Those parts do not matter to us. We just need to know where you live, and that's how we rate. Additional benefits such as teeth whitening, orthodontia, and hearing care are provided. On our middle level product, we have 3 dental products, 2 vision products. Our vision products, there's one with iMed and one with VSP. For our dental products, we have it's called our Prime Star Light product. This is our lowest. There's not much flexibility. It's a lower maximum. It's usually around 1,000. just lower coverage overall. Then we have our middle product. This one offers orthodontal care. So for those kids, you can make sure that they are still getting the braces that they need. For our highest, our Prime Star Elite product, this is where you can get hearing care. You get up to $75 towards exams that you can use, and then a certain amount of money for hearing aids. So we're making sure that you're covered, you're cared for, and if you have any questions on this, I'm more than happy to send you out more information. I think this is, once again, where we really starve for that individual product. It's where we are able to protect and provide care for seniors that other competitors and Medicare really cannot. Medicare, there's limitations around key benefits such as implants, which is really necessary in that age group, as we all know. That you get limited benefits. You are restricted in your network, or there's no network at all. There's a disrupt dental plan when you change your medical plan. So things are always changing. You aren't really able to have confidence in what you have, in your coverage that you have. By simply going to that standalone product, and our standalone product really range from $20 to $50 based on the level of care you get for that individual care. You get robust dental coverage. You don't have to coordinate your benefits. You don't have to worry about if Medicare is offering this, I need to think about this factor and this feature, etc. You understand where I'm going with this. Extra value with network savings. You save a lot of money by going to an in-network provider. And if there's no network, you aren't able to save that money. You are able to keep higher benefit levels without changing medical plans. So definitely a thought to make sure you always remember with that Medicare stuff, it doesn't provide full coverage. So push your clients, push your people to go towards that standalone product because they will end up having a lot more coverage at the end of the day. Understanding trend versus your group. What a group needs versus what trend tells us they need. So it is a known thing that most people will not utilize their full dental maximum. If there's a $500 dental maximum, a $500 dental maximum, there will only be 24% of people who will actually end up utilizing that full maximum. $750, only 17% will utilize the full amount, and so on and so forth. By the time you get to $2,000, only 4% will utilize that full maximum. Do you really need a large maximum? That's the conversation. That's the debate. There's trend. Your employers are always seeing these trends going around nationwide that, hey, in order to get the best employees, you're going to have to give the best benefits. That's always a conversation. But do you really need to pay all this money for coverage that's not necessarily necessary at the end of the day? There's a huge trend, as we mentioned, that has moved from $1,000 to $1,500 maximum to a $1,500 plus maximum. So as of 2012, 49% of people had a maximum between $1,000 and $1,500. Now that same percent as of 2021. And this number has definitely increased since 2021. I know this is kind of outdated information at this point, but 48.2% as of 2021 had a maximum between $1,500 and $2,000. So it's definitely a different era. It's definitely changed. But once again, you have to look at what the clientele is, what the census information is for your employer group, and really understand what that group needs versus what trend is telling you that they should have. 88% of workers would give consideration, some to heavy consideration based on health and dental coverage. So based on, there's 34 or 88% of Americans would say, hey, if I'm offered a better medical and dental plan, I'm more likely to be swayed towards a different company than one that's provided that I also got a job that has less coverage. So employers need to design products that are competitive to stay relevant within that ever-changing market. Carriers change their products constantly to align with the new trends. Work with us. We are able to offer a lot of flexibility within our product to make sure those employers have the best possible care and coverage that they need. Things to look at. I kind of mentioned this previously. Look at the location. Census zip code locations do affect rates. Rural versus urban play a huge effect. Rural, your rates are going to be significantly lower than urban rates would be. So pay attention to that. We understand that people who live in more city settings have more access to dentists and are more likely to go, while rural people who live in more rural areas are less likely to go. Industry type, white collar versus blue collar. White collar industries typically go to the dentist more, so this will affect the rates. Gender does not affect the rates, but affects how often people go. Age also affects these kind of features. So there's a lot of things to look at, and to look at the balance on the census to really understand what that group needs versus what trend is telling you that they should have. Our network. This is truly, I think, the most important part. If you are not confident in a provider's network, it's just going to make everything more difficult at the end of the day. Nationwide, we offer a 39.3% average discount. So your employees, by going to an in-network provider, can save up to 39% on their network. 65.8% utilize our network nationwide. So a huge portion end up going to that in-network provider because they know that they can save significant, substantial money by going to that in-network provider. We're always trying to push our people to make sure that they're going to in-network providers, and we beg you and ask you to do the same, because at the end of the day, you save so much money by going to a network provider. And as I mentioned previously, we have 592,000 access points nationwide. So, as many of you know, a lot of providers or a lot of carriers offer two networks. Here at Ameritas, we only offer one. Our competitors offer that 30 to 40% discount on that first network. And then they have a competitor secondary network that offers a smaller discount on those products. We decided as a company that that's not necessary. You end up not saving as much money. And we ended up putting everyone within one network, and that is our PPO network. So we have one network as a company. Everyone falls under that category, and you do end up saving 39.3% nationwide. That is our average discount overall. I'm going to put out another poll. Never mind. It seems like that poll has disappeared. Oh, you already answered it. All right. Around 40% is our average savings. So you are able to save a ton of money based on going to that in-network dentist. All right. Our network in your area. So we are currently the fourth largest network in the Harrisburg area. I'm happy to send you a report based on any other part of the country if you are interested in seeing. This should come to no surprise. United Concordia, being in your backyard, is the largest. Principal also has a significantly large network. Delta's Premier Network is also slightly larger, but not by much. As I mentioned before, that Delta Premier Network is that secondary network. So it does only offer savings of 10 to 15% usually. Our network, though, is pretty similar in size overall to that Delta Dental Premier Network. So important things, make sure you're always paying attention to this information to make sure you understand the level of coverage and the number of people in network overall. All right. So comparing out-of-network pocket or out-of-pocket costs on crowns if you go to an in-network provider versus an out-of-network. So our fee-based provider agreed upon price is that $840 per se. This is not necessarily 100% accurate, but say it's at $840. Out-of-network, that normal fee is $1,370. 50% coinsurance. That happens on both sides. That doesn't change. If you get 50% off, if you go to an in-network dentist, you pay $420. By going out of network, you pay $685. Substantially different. Big difference. What that also affects, your maximum. As we talked about, your threshold. If you go over that threshold, you aren't able to save. If you stay under your threshold, you are able to increase your maximum at the end of the year. What out of these two individuals, you have a much higher and better chance to save money at the end of the day and have a better chance of increasing your maximum if you do go to that in-network provider. All right, here's some resources for you. This is where we're going to end today. Didn't end up being a full hour, but I wanted to leave some time at the end to answer any questions that you have. So, small group. This is your under 100 section. We have your group service team. This is client facing. This is if your clients want to go themselves to ask questions, they are able to call this number. It's 1-800-659-2223, and that number will be listed. We also have an email address. That is our group assistants at Ameritas.com. Once again, that will be listed at the end, so don't worry about writing this down at this time. Our diamond team, this is my favorite team to talk about. This is a broker-facing team that you as a broker are able to reach out to for your under 100 section and ask questions to. So you simply send them an email saying, hey, I need help. They're able to fix it themselves, or they'll point you in the correct direction. They'll send your email to who it needs to get to in order to fix those issues. You have your local sales rep, that's me. And then your sales support analyst, that would be Pam. To go back to that diamond team really, really quickly, anytime I've utilized them, they've gotten back to me within an hour or two. They're extremely fast. They're extremely effective. You simply, once again, send them an email and they'll help you and make sure you are pointed in the correct direction. For that large group, that over 100 section, you get a group service team, as mentioned before. However, you also get a dedicated account manager. This person is in charge of your group and is given to you as soon as that group is enrolled into our system. And their job is to make sure your group is running well. They'll reach out to you occasionally if they notice something is going wrong, premiums delayed, any of those kind of things, they'll reach out to you. Make sure everything's going okay. Just another great resource. And then you, once again, have a local sales rep, that's me, and a sales support analyst, which is Pam. For that national group section, that's over 2,500. You get all of the above for that large group, as well as an implementation manager. Somebody who is making sure that implementation runs smoothly as best it possibly can to make sure that group is ready for anything. Benefit platforms. Here are some of the people we partner with. We partner with most benefit platforms. If you have any questions, if your benefit platform happens to fall within who we utilize and who we partner with, please let me know. I would say 99% fall within who we work with. So do not worry if you do not utilize one of the ones on the screen currently. All right, we are here to help Monday through Thursday, 8 a.m. to 8 p.m., Fridays, 8 a.m. to 6:30. The number, once again, is listed on the screen in that group assistance email. Those are the most important contacts other than me that you can have within the company. That is all I have for you today. I'll pass it back over to Courtney now.
Thank you, Allie, again for all the useful information about dental and vision. And does anybody have any questions for Allie? I don't see any in the chat right now, but the floor is open if anyone does have any questions for her. Either you could take yourself off mute or write it in the chat feature. Also, if anyone doesn't have any right now, but then you think of it after the presentation, you can definitely send me an email, send Allie an email, or send that email to the group assistance that she had in the previous slide, and we will make sure that we get it answered. Please don't hesitate to reach out. And thank you all for joining again on this Monday and kicking off your morning with us and your week. And if nobody has any questions, thank you again, Allie, and thank you, everybody. And I hope everybody has a wonderful week.
Thank you all.
Thank you.